I think it's kind of notable when you have a hearing on how to improve outcomes and lower costs. Most Republicans show up. We have the ranking member here on the Democrat side. It's pretty interesting. We're looking ahead at how to do that, but I think in order to fix a problem, you have to really define what the problem is. You have to look at the past. And I don't want to dwell too much on the past, but right now there's been a lot of talk about extending the enhanced temporary subsidies that were put in place to help people through the pandemic. So I have to talk a little bit about Obamacare. And Ms. Lambrew, you were part of the Obama administration after the passage, but leading up to the implementation of it, correct? So you were there when President Obama was out there saying that Obamacare would lower the average premium for a family by $2,500 a family, correct?
I was there when we talked about slowing the growth of healthcare, yes.
President Obama made that claim, right? $2,500 lower premium per family, correct?
Over time with slower growth.
Okay, that hasn't panned out, has it?
It has.
It has not.
We have seen slower growth.
Inflation has gone up
35%,
39% since 2013. I've seen, again, it's very difficult because you have a whole range of premiums, but just one benchmark premium's up to 118%. That's 3 times the rate of inflation. So no, that did not occur. Premiums have skyrocketed because of the faulty design of Obamacare. President Obama said you could keep your doctor, you could keep your health care plan. That was PolitiFact's 2013 lie of the year, correct?
Today, there is no lower percentage of people with employer-based coverage than there was
but people
before
lost
the
their
law
doctors. For example,
passed.
Obamacare outlawed high-risk pools, which worked beautifully in states. They worked beautifully in Wisconsin. As an employer, we use them all the time. It worked great. You outlawed those. You outlawed short-term plans. So again, that was PolitiFact's 2013 lie of the year. Let's just look at enrollment history. Obamacare impacted Medicaid expansion, okay, and there's problems with that, but let's focus just on the individual market. That was the other thing that Obamacare, again, fix all these, this marketplace for individuals. There are about 12 million people prior to Obamacare taking advantage of the individual markets. You completely disrupted that, got rid of high-risk pools, got rid of short-term policies. Before the pandemic, there were 14 million people on the Obamacare exchanges, so 2 million more people on these individual policies. Then all of a sudden, with the enhanced premiums, all of a sudden we're up to 24 million people. Now, are you aware of the problem we're having with the no premium policies, of phantom policies where you have unscrupulous agents and brokers signing people up without their knowledge? They get a commission. The premium tax credit goes directly to the insurance companies. We've seen estimates $20 to $30 billion per year of premiums going to the insurance companies on phantom policies. People make no claims on them. Are you aware of that?
I am aware that there are agents and brokers that have been falsely signing people up. Last year, action was taken. 500 of them were unsubscribed.
So we've gone from...
This year, the H.R. 1 did include many policies to address that. But the reality is that those people are the victims, and we are trying to make sure that we keep them covered when they want to sign up for coverage.
My point being, went from 12 million to 14 million, now up to 24. That's not 24 million real people.
The uninsured rate in the country,
that aren't even there.
dropped,
So
sir.
again,
Yes.
you're saying this is going to be a huge problem. Now, isn't it true that the original design of Obamacare, there were no subsidies for people making more than 400% of the poverty line, correct?
Yeah, there are currently 3 to 4 times more
Just answer
subsidy
the
for
question. The
people
original design of Obamacare, nobody working or making more than 400% above the poverty line got a subsidy, correct?
People who have employer-based coverage get a subsidy. People with Medicaid get a subsidy. People before the Affordable Care Act buying coverage on their own,
so
the retiree,
so the enhanced
the farmer
subsidies
could not get
the
help from
enhanced
the federal
subsidies
government.
the enhanced subsidies started providing subsidies for people above 400% poverty. Your chart here on page 6, this is talking about people higher out-of-pockets that didn't qualify for subsidies in the original Obamacare. The subsidies aren't going away when the enhanced premiums go away. The original design of Obamacare stays in place, correct? Correct?
We know that people have been significantly helped by the improvements that were made in 2020, and people will be hurt if they leave. Those were many pandemic policies, telehealth,
those were temporary enhanced
tax credits,
those were temporary enhanced subsidies, And the Democrats, in their law, they scheduled them to expire this year, right? Republicans had no point in that at all.
The 2017
part of that at all. That was designed by Democrats to
also
expire.
extended, policies that ended, that just got extended without being paid for. Tax
So again,
extenders happen all the time.
you are claiming harm to people that never qualified for the subsidy under the original Obamacare. Now you're also saying, because you're quoting people at the hospitals, if these enhanced subsidies expire, as they were meant to do by Democrats, it's going to be a calamity for the hospital industry. All that's happening is we're going back to the original Obamacare. So what you're saying is going back to the original design of Obamacare is going to be a calamity
Going
for
back to
hospitals?
1965 practices for medicine are also a calamity. I mean, we figured out something that worked. It should be extended. People have been helped by it. Costs have been growing slower than private employer-based coverage. Choices have gone up. Could it be improved? Without a doubt. But I think it is a fact that the uninsured went down. Cost growth have not been excessive. We have more choices. Deductibles have actually gone down. We really have seen in the last few years people able to choose deductibles that are now on average $400, not the higher amount. So I think the numbers show that the policy has met
a
number of goals.
My point is, if these enhanced subsidies expire, all that happens is we go back to the original design of Obamacare, which didn't work, didn't lower premiums. People couldn't keep their doctor, couldn't keep their health care plan. It's been a disaster, and the reason Democrats want to extend these subsidies, the reason we have subsidies, is to mask the fact that Obamacare drove premiums sky high, and what this hearing is about is how can we bring those actual premiums down, deliver better outcomes, and we've got some great examples here. Doctor from Oklahoma is doing some marvelous things. It's called bringing consumerism, the free market principles back into healthcare. Republicans were interested in that.